I'm Dr. A Santosh. I'm a consultant nephrologist and a transplant physician working in Kamineni Hospital, Nagar for past 8 years. First thing is, as we know, kidney is a very beautiful organ, or it's a marvelous organ. It's the best piece of probably the nanotechnology which God has created. It has almost 1 million nephrons, or almost 10 lakh microfilters which are there in each kidney. So each person is born with almost similar nephrons. It might vary from person to person, and depending on whether it's a preterm or full-term delivery, the number of nephrons or the filters which are there, they might vary. So those individuals who are, let's say, preterm born or so, there is a slightly higher chance that they might develop kidney failure. And apart from this, the general precautions, general risk factors which are there are patients who are diabetics, hypertensives, those individuals who have been on chronic medications, and also any of the organ failures like liver failure, heart failure. Apart from that, autoimmune diseases like lupus nephritis, these are all called collagen vascular diseases. Apart from that, newer patients who have recurrent urinary tract infections, those people who have abnormalities in the urinary tract leading them to develop either urinary tract infections or high pressure bladders wherein the urine will not come down, it usually goes up into the kidneys also. So these sort of individuals are at a higher risk for developing kidney failure. Among these individuals, we also find a newer hereditary diseases also. Hereditary diseases, what happens is some of the individuals who have polycystic kidney disease or any other organ failures, any other kidney related issues can develop kidney failure. So how do we recognize them? The basic thing is for us to understand those individuals who are at risk, and then identify those individuals and go ahead for regular testing to identify whether they have developed kidney failure or not. The basic tests which we usually do are renal function test and completed an examination, or to understand whether the kidneys are normal size or not. Some individuals we also advise them to go ahead for a scan, and we also check for any protein loss which is happening in the urine. So these are the basic tests which are required to identify. In these individuals, or those some of the patients who develop kidney failure in the absence of any other abnormalities tend to develop it in sort of two types of fashion. Those individuals who have kidney failure which doesn't have protein loss, and those individuals who have protein loss. So let's say protein loss individuals are there, they tend to present to us a bit early because the symptoms usually present a bit differently. The symptoms are more prominently present. So the symptoms which are usually present are swelling of feet, or facial puffiness, or abdominal distension, recent onset rapid gain in weight can be present. So these individuals, whenever there is a lot of protein, they also have hypertension also. They tend to progress a bit faster. At the same time, they also present to us a bit earlier. And the other group of individuals usually have a slow progress kidney failure, which is a bit undiagnosed, or they might have developed kidney failure for a longer duration, but usually it is not recognized. So once these individuals are noticed, then what we have to do is they have to be under regular follow-up to identify. Apart from that, what else can you do? As a healthy individual, your goal might be to see that you don't develop any renal failure, you don't develop compromised kidneys. So what can we do? The first thing is maintain a healthy lifestyle, have a regular exercise to be done, and see that you don't go for excessive either fatty food or a heavy high protein diet, etc. is not advisable. Some of the lifestyle changes have to be done. Apart from diet alone, you need to go ahead for regular exercise as well, and see that you don't have any other addictive things, like let's say taking a high amount of alcohol, or tobacco chewing, or cigarette smoking. These usually they do contribute to heart failure predominantly. At the same time, they also contribute to renal failure as well. So those individuals who have kidney disease, for them I would advise to take good amount of water, see that they never become dehydrated, and maintain it in such a way that their urine is always almost liquid, watery in content, or it's almost like white in color. It's never yellow. So the moment it is yellow, it means that they're a bit dehydrated and they're taking less amount of water. So people who are at risk and those people who have chronic kidney disease, what we should do is we have to keep on surveilling them to identify what sort of kidney failure is there and how their kidney failure is progressing. So based on the same test, probably we can take better care of it. At the same time, we also have to notice those causes or reasons why kidney is actually progressing at a faster rate. So some of the medicines can be contributing to it. It could be either herbal medicine intake, or some sort of dietary changes might be present. Most of the times what I notice is people taking a lot of leafy vegetables, so they start taking some other concoctions which might contribute to rapid progress in renal failure. And some of the even some diet itself, like star fruit is one of the fruit which usually contributes to rapid renal failure also. And very high protein intake can also cause rapid deterioration of the kidney failure as well. So once we are recognized, we need to also see how they are progressing, and we need to prepare for the future event that they might require dialysis. So at this moment, what I would be concerned mainly is educate yourself regarding how the kidney functions, how you can recognize them earlier, how you can start monitoring yourself and taking proper steps at a proper time. At the same time, it's not just the general population who has to be educated, but as well as other doctors as well, who have to realize that early recognition and early intervention itself can save kidneys for we can maintain the kidney function slightly longer duration.